to Health Talk. My name is Margaret Wang. I'm currently a master's student in the Counseling Psychology program at Santa Clara University. Today we have with us here Victor Chen, a former high school football player and graduate from UC San Diego with a degree in human biology. Today we're going to talk about sports injuries of the lower body, including the knee and ankle, and how to prevent some of these sports injuries. So tell us.
So I'm just going to start off. I'm a pretty avid sports player. I played football in high school. I swam and I wrestled, and I also ran my first marathon last year.
Congrats.
Thank you. So one of the most important things about a lot of injury prevention is making sure that your exercise regimen is well scheduled. So basically making sure that you have a training plan, and instead of jumping into an exercise all of a sudden, you really have a measured progression up to the goal that you want to reach. So the first injury that I want to talk about is sprains of the ankle. Right?
Okay.
Everybody sprained their ankle at some point, not just competitive athletes. Sprains can vary from different degrees. You can have a level 1 sprain, which is when you're not paying attention and all of a sudden your foot slips on the curb, and we've all rolled our ankle at some point like that, up to a full tear of your ligaments. And your full tear of your ligaments, you can really get a lot of swelling and a lot of bruising in the area.
Okay. So tell me a little bit about the difference between a strain and a sprain, because I'm sure they're pretty different in terms of recovery and physical therapy. What's the difference?
So a sprain and a strain, some people get them confused. A sprain is a tear in a ligament or an injury to a ligament, which is a connective tissue that connects bone to bone. So your ACL is one that's pretty common, that's in your knee, and a strain is a tear or an overstretch of muscle fibers or tendons, which tendons connect muscles to bones. So if you bend over and you pick something heavy and you're not doing it right, and you you tweak your back, you strain your lower back.
So it's a little more severe, granted that you're kind of tearing these fibers.
Well, strains and sprains both kind of have a scale of severity. So you can kind of have a minor strain in your back, or you could really tear some muscle fibers. But in terms of recovery, minor strains and sprains both, we just use the common acronym RICE to rest it, ice it, compress it, and elevate.
Right.
I'm sure many sports therapists, a lot of coaches have told me that through the years. So if you get injured, just mainly staying off of that foot, resting it, allowing it to heal on its own. I had a pretty severe ankle sprain. It was a grade 2, where I partially tore part of the ligaments in my ankle, and I noticed the next day it was bruised, it was swollen. I really couldn't move it. But a lot of it was simply just immobilizing it. I went to a doctor. He just wrapped it so that I couldn't move it too much.
Right.
And he told me to just try and move it a little bit without pain, just to try and get more blood flow through, and putting me on pain medication, but allowing the body to just heal itself.
Okay. And then what does that recovery process look like, or how can you go about preventing these?
So a lot of strains and sprains, just making sure that you know your own body limits. That time when I got that grade 2 sprain it was a long day. I was with my friends. I was playing volleyball, and I made a jump shot that I really probably wasn't ready for. I didn't set it up properly. So I was tired, and I kind of sloppily jumped in the air. And when I came back down, I didn't catch myself properly, and that foot just went right under me. So it's just being aware of how tired you are, and also really knowing your limits, being sure that if you've been sitting on the couch for 6 months, not exercising, not running, not doing anything, deciding to jump into a pickup soccer game, or a pickup basketball game where you're shuffling back and forth and really trying to be athletic, probably isn't the best idea. To really think about where you are at a physical level and try and build up to where you want to be, or where you think you should be.
So it kind of sounds like you have to know your body and understand how much strain or pressure that it can take, and kind of work your way up rather than go immediately from 0 to 100.
Exactly.
And but what about building the strength of the muscles around these potential areas of injury?
Definitely. So that would come as part of your just training schedule. Just for example, when I was training for my marathon, there were days when you would have your run days where you would actually go and run X number of miles, and you know, it would progressively increase throughout the months leading up to the race. You would also have strength training days where you would really focus on building those fast twitch muscles that you know are used for explosive energy, and most importantly, rest days that allow your muscles to recover so that you don't overstress them and overuse them, and that can lead to a lot of damage as well.
So there's this period where you have to rest, and you also have to work on those opposite muscles. So I've heard that there, you know, you have, let's say you have the quad, you have to work the hamstring. So you always have to do the opposite, kind of like you have to do the fast and slow twitch muscles.
Yeah, so just as a distinction, your fast and slow twitch muscles are different types of muscle fibers. Your fast twitch muscles are really responsible for the explosive power, and when you see the Olympic bodybuilders or those weightlifters, you see that they're really, really big, just size-wise. So those fast twitch muscle fibers fire immediately, but they fatigue really quickly.
Like in sprinting.
Yeah, like in sprinting. So sprinters are really, really muscular. But if you look at a lot of the long-distance athletes, a lot of the marathon runners, the ultra-marathon runners, they're really lean because they have a lot more of those slow twitch fibers that allow them to use their energy very efficiently, but use it for a really long period of time because those muscle fibers don't tend to fatigue as easily.
Okay. So almost like two different purposes.
Exactly.
One is for kind of short-term stamina, and one is for building endurance.
Exactly. And then as you were talking about working both sides of the muscle, like the quad and the hamstring, that actually goes into a lot of muscle imbalances and things that may lead to a lot of the knee injuries that we're probably going to talk about in a little bit. So one, just as a kind of foreshadow, we're going to talk about a little bit of patellofemoral syndrome, which is more commonly referred to as runner's knee, where sometimes the patella, your kneecap, kind of doesn't track properly and kind of tracks over the bone improperly, and that can lead to pain and discomfort for a lot of runners.
Okay, and is this from just the constant pressure and pressure on the joint, or how does that work? And what can you do to prevent that? Because, you know, especially for long distance running, you need that knee. So
a lot of good running comes with good running form. So making sure that your strides are, you know, properly placed, that you're not overstriding. That's a common running problem that can cause a lot of knee and ankle pain, and also making sure that you're also you're balanced with your movement, so that your feet aren't turned out when you're running. That's a big issue. So making sure that your feet are parallel and you're striking underneath yourself.
Okay.
So by turning out, you can actually overdevelop one side of your muscle and underdevelop other sides, and that can lead to potential issues with patellar tracking and things like that.
Okay. Okay. I also know that the Acl tear is pretty common in a lot of sports, like, you know, soccer for women, football.
Yeah, so
list goes on.
Yeah, of course, the list goes on. The Acl tear is not really a close friend of mine, but pretty close. I had a lot of friends who played football who had minor tears, or I didn't. Fortunately, nobody on my team had a complete tear, but you see that a lot in the professional sports. But just to get our home viewers oriented, I'm just going to do a quick little demonstration on kind of the anatomy of the knee, just to kind of wrap your head around it. So if you imagine that my arm here is your thigh, and this is my lower leg, and this is your knee. It's a 180-degree hinge, or 90-degree hinge-ish, and you can imagine that this part is the middle of my knee, and my pinkies over here are the outside. So this would be my right knee. So your kneecap sits right here in front, and your ACL, your anterior cruciate ligament, sits towards the front right here. Your posterior cruciate ligament, your PCL, is here, and you have two cups of cartilage, or meniscus, which are two C-shaped cups that sit kind of on top, and they allow that hinge to move. You also have two other ligaments on the side, your MCL and your LCL, and we'll talk about injuries that occur with those. But your ACL is a pretty commonly injured ligament, and a lot of what happens is people suddenly stopping, or those explosive movements like in football where a wide receiver is running down and then all of a sudden he cuts to one side.
Okay.
So that strafing movement, that sudden stop and redirect, that puts a lot of strain on the knee, especially that ACL. So if he receives an impact from a defensive player, or even if you're not trained properly, if say all of a sudden you decide to play tennis after sitting on the couch for 6 months or a year, and you try to do the explosive stop, you're like sprinting and all of a sudden you stop, you could partially tear your ACL, and that could present some problems.
Oh.
Yeah.
Oh. So what can you do to strengthen the muscles around the ACL? Like, would you work on the inner thigh muscles or the hamstrings to prevent this kind of injury? What can you do? Because you obviously don't want to get surgery.
Of course not. So in general, like I said before, it's a lot about measured training and training properly, making sure that you incorporate weight training in with your regimen. A lot of these injuries come with just most athletic injuries come with people who, or result from people who try to do something all of a sudden and really don't take that time to gradually build their way up.
Oh, so again, it's like people don't give themselves that adjustment period.
Exactly.
Okay.
So along with the ACL, a very common football injury, they call it the Unhappy Triad because it's 3 injuries that we see together a lot, is your ACL being torn with your meniscus, which is that cartilage disc, and along with your MCL. So unfortunately for me, I got 2 of the 3, and I partially tore my ACL and my medial meniscus when I was playing football. I was hit from the side, and it was not a good thing for me. So that's a really common injury, and sometimes that requires surgery. A lot of the symptoms that I experienced were locking of the knee. I wasn't able to move it properly. I could only bend it. I could only straighten it maybe. I could only straighten it maybe like 120 degrees, 130
Oh, so you
degrees.
had like a limited range of motion.
Yeah, I had a very limited range of motion, and I really didn't understand what was going on.
Right.
And the recovery on that was difficult.
So what did that recovery look like? How long did it take? What did the doctors tell you that you could do to prevent this from happening again, or that you would be able to play sports in the future?
So after I actually got that injury, I was told that I needed surgery, so I actually had a laparoscopic procedure. It's actually very minimally invasive, where they take probes and they actually only make 3 small incisions in the knee.
Okay.
And they insert the probes, and they're able to suture the meniscus, that little cup of cartilage I was talking about earlier. The only problem with that is that since that meniscus is cartilage, there's not a lot of blood flow running through there. So the recovery time is incredibly long. Because I was only 14 or 15 at the time, the surgeon decided that it would be best to actually suture it and allow it to heal naturally, as opposed to a very common procedure, which is just removing that part that is torn. She told me that removing that part that was torn could have potentially led to arthritis in my knee in later years and things like that. And of course, I didn't want that.
Bad long-term
Of
effects.
course, yeah, bad long-term outcome. So that recovery required, I was on crutches for about 5 months. I wasn't allowed to put any weight on it, and there was large amounts of physical therapy afterwards. So that's the price that I paid for being hit.
Yeah. Oh, that's rough.
It's a pretty, like I said, I ran a marathon last year, so the recovery isn't that while I was recovering in high school, it was rough, but I feel like I've had a pretty good outcome.
That's wonderful. What do you think made it possible so that you could be a runner today with your previous ACL injury?
So a lot of that was, once I had that knee injury, I was very, very careful to, like I said, be very gradual about my training.
Okay.
once I had made sure that, that knee functioned properly, and, obviously I had my checkups and made sure that that cartilage had fully healed, I was able to just gradually build up. And, I started off, with the baby races, just a 5K, a couple miles, and then, gradually building it up. So taking it back to that point where instead of just really trying to jump into something and, go for it all of a sudden, I ran a bunch of races before I actually did the real thing. So
that's great. So you've gotten to know yourself in that process.
Exactly.
And kind of learn to take baby steps before getting to the main goal that you wanted.
Yeah.
And also it seems like strength training is also something that you need to do to make that possible.
Yeah. So a lot of strength training will not only strengthen your muscles, but also strengthens the bones and all of the structures around it, and just make sure that, the joints and your muscles and everything work together in an effective way.
Okay.
Unfortunately, I only had, that injury with the meniscus tear in the ACL. Other common knee injuries include fractures. A very common knee fracture is the patellar fracture, usually from like an impact or something like that.
Okay.
And that's similar. You might need some surgical intervention, or, if it's not super severe, then just keeping off of it and letting the body heal.
Okay.
Yeah.
So you've kind of talked a lot about how there's this time period where you have to allow your body to recover naturally. There's also a part where you just have to know yourself and kind of ease your way into activities, and then incorporating strength training in your regimen.
And of course, these things are just knowing yourself, and of course, if you have any medical issues with your knees and joints, of course, consulting with your physician, or, an orthopedic surgeon, somebody who, if you've had previous surgery, who can advise you from a medical standpoint to make sure you're not doing further harm to it, and making sure you're training properly. I mean, you of course want to consult an expert before you go out and do anything crazy, like, running 100 miles in an ultra marathon, or, things like that.
So consulting experts, meaning physicians, physical therapists, before you go out and run that marathon.
Exactly.
And but what if you want to transfer from one sport to another that's just as high impact? What would be a good strategy, would you say?
Of course, I would talk to a trainer or somebody like that. But a lot of the athleticism that you build from one sport transfers really well into athleticism from other sports. So I found that although it is really different, because playing football for me was very explosive, and like I was saying earlier about the fast twitch muscles, we focus a lot on heavy lifting, hitting hard, moving quickly, and everybody who's watched a football game knows that you have those plays that last a couple seconds, and then it's over, and you reset and you have another play.
Yeah.
It's a very different type of movement compared to, say, running a marathon, where you're in constant motion and you have to keep going for 26 miles.
Right.
That's so really trying to transfer, so that strength aspect helped me kind of stabilize my knees and make sure that I was strong enough. But that endurance aspect was something that I really had to build on, and I kind of had to start from square one, even though I thought I was relatively athletic. Really training for that endurance aspect of it. So yeah, running also. Actually, my first couple of days of running, I experienced a really common sports injury that a lot of athletes might have experienced, called Shin Splints. And that's I've a lot of my friends playing football, and runners and track athletes, and that's just your tibia, which is your shin bone, and a lot of undue stress on it causes some inflammation and a lot of discomfort.
Okay. So tell us a little bit about how shin splints happen. I know that from my own experience that sometimes it's because too much running too quickly. Tell me a little bit about the physiology behind that.
Yeah, so a lot of I guess people agree that shin splints are a result of, they can happen when you're doing like sprints, like large amounts of heavy activity, and then like slowing down, and then sprints.
Oh, so kind of like the fast twitch alternating between
Yeah.
the fast twitch and slow twitch muscle movements.
And especially if you're not used to that movement, you can get more inflammation. A lot of people recommend that, you know, you don't do those sorts of exercises in worn out shoes, that you know, have properly supported footwear. And shin splints occurs in people with, you know, flat feet more, and also people with really rigid high arches more of the foot, simply because I'm actually not sure about the physiological mechanism behind it, but I guess they see a correlation with, you know, that inflammation in the tibia as a result of that.
Okay, okay.
Yeah.
I've also noticed that from past experience when I've had shin splints that physical therapists would have me work on strengthening both the calves and the front of the tibia, so that way both of those muscles can work in conjunction.
Yeah, so really going back to that strength training aspect and working those opposing muscles. Excuse me. Making sure that you don't have any muscle imbalances. And another thing that when I was doing physical therapy for my knee was they would focus a lot on like icing and elevating it. So even if you have a really bad bout of shin splints, most people can recover just by elevating, resting, icing it, and, you know, using a compress. And it just, you know, feels pretty relaxing to kick your feet up with an ice pack.
So just going through that routine of practicing rice really helps with recovering from shin splints, but also working on those oppositional muscles.
Exactly.
I also found that, you know, maybe we can get an expert in here, but one physical therapist had me work on other muscles that you wouldn't expect to be impacted by the shin splint injury. But she had me work on the gluteus maximus, or this area, or the hamstring and the quad and the core, just so that those muscles could take a lot of that pressure and strain instead of the shin splint area.
Yeah, so a lot of the, I guess, reading that I've done has shown that, I mean, your body works together. I mean, there's no way to separate your leg from your torso. You know, everything works together, and making sure that you're physically fit, you know, as a whole person, you know, is really important, especially if you want to be a well-rounded athlete, somebody who, you know, plays a really active sport. A lot of trainers that I've talked to say that, you know, people who are at the gym a lot, people who train with weights, really overdevelop certain sides of their body. You know, men especially really want to go to the gym, and they really want to, you know, lift really heavy, and when they bulk up.
Yeah.
And a lot of people focus on the bench press, which focuses on that front of your chest and focuses on your triceps. Well, if you're overbuilding your front side, you get muscle imbalances and your back is relatively weak. Or, you know, if you're doing crunches all the time, but you're not focusing on that lower back, you know, you're imbalanced. So if, you know, you're going for the all-around athlete, say like a gymnast, gymnasts particularly are, you know, concerned with body weight exercises and things like that, and being able to really lift themselves. That is really important to be a well-rounded athlete. I mean, you can't expect a gymnast to just, you know, be doing push-ups all the time and not really focus on their back, because they need those back muscles to lift them up and, you know, do everything that they do.
Okay, so there are basically some sports that require more well-rounded and, I guess, toning of all of the muscles rather than specific areas. And that kind of might be more helpful in preventing injury because you're more balanced.
Yeah. And I mean, that also goes back to your point about kind of shifting from different sports and athleticism. There was actually a really interesting article that I was reading earlier about a bodybuilder trying to break into gymnastics because he had been training with weights his entire life, and he was used to using those really explosive muscles, which are the same muscles that you use as a gymnast, but since he had built himself differently, some of those movements were very difficult for him, especially since he was much larger.
Oh, fascinating.
So, you know, that's something that we might be able to talk to in a different show.
Yeah.
But I also wanted to get to, sorry to jump back, but about kind of physical therapy and recovering. I know I wanted to touch on that a little bit.
Yeah.
So a lot of the physical therapy that I experienced was a lot of strength training, and like you were saying, things that you didn't expect. Like my knee injury, I was training my hamstrings and my quads, right around the knees. But he also my physical therapist wanted me to train my core and my lower back as well, just to kind of make sure that everything stays balanced and was in alignment. I also got exposed to electrostimulation of the muscles. I don't know if if you've had that while you were doing physical therapy.
Yeah, I've definitely had Electro Stim.
Yeah.
So tell us about how that works.
So Electro Stim, basically I would have it at the end of every physical therapy session, and it just uses electrical impulses from this machine to stimulate the muscles. It kind of gives you a tingling, numbing sensation. Yeah. And from my personal experience, I felt it was really relaxing and helpful to just kind of loosen everything up.
Right.
Physiologically, it just kind of helps fire those muscle fibers, and just kind of helps you relax.
Okay, so it's a different way of kind of activating those muscle fibers.
Yeah.
In addition to the recovery of targeting those other muscles that can help support the body.
Exactly.
Okay. Any other strategies you'd like to share before we end here?
I mean, in general, I just wanted to espouse a philosophy of, making sure that you really know your limits, you know your body, not pushing it past some boundaries. Of course, you're going to experience some discomfort if you really want to, make strength gains, if you want to go to the gym. I don't know, I keep a little log notebook, of what I've lifted, and, really trying to push that boundary for myself to make me a better, athlete. But really trying to not go too far to the point where, I'm pushing myself to a point where I'm uncomfortable, or where I put myself in a spot where I could be injury prone. Of course, consult with a trainer, a personal trainer, a physician, somebody, an expert for you to kind of tailor those exercises so that you can become the best athlete you can be. And so knowing your limits, training gradually, and if you do get injured, unfortunately, consulting a physician and weighing your options, whether it be surgery or some non-surgical options where you could just let your body heal.
Okay, great. So, kind of to recap, you kind of talked a lot about knowing your own limits, knowing your body, and working your way up toward a specific goal rather than jumping right into a marathon or a specific sport.
And that's really important for your knees especially.
And then on top of that, being able to do strength training that might counterbalance these main muscles that you're using. And as a result, focus on fast twitch and slow twitch muscles. And then always consult a physician and physical therapist before you jump into anything.
Or a trainer or somebody who, can really help you, achieve the goals that you want to achieve.
Okay, great. And I guess lastly, we talked about using rice. Yeah, rice,
and basically, if you do find yourself injured and it's not something that's super severe, taking aspirin or some NSAIDs, non-steroidal anti-inflammatory drugs, and just letting yourself rest and recover, just allowing yourself that rest time.
Okay, so rest is really an important part of that sports regimen.
Yeah, definitely.
All right.
Even if you're, especially my trainer's always focused on, you lift really hard, but you really need to give your body that time to recover and regenerate those muscle fibers, and just not overstressing your body.
Okay.
There's lots of injuries that come with overuse, and
all right. Well, thank you so much. Thank you for sharing all the strategies that we can use to prevent injury and recover. Thank you.
Thank you.